In this video, I'm going to talk a little bit about how we go about managing patients who have POTS that reaches diagnostic criteria and those that have orthostatic intolerance that does not reach diagnostic criteria, and the many symptoms that tend to go along with these conditions. A very simple approach can be looking at some lifestyle factors that can either trigger or worsen symptoms. So for example, the environmental temperature can be quite important. On a very warm day, it is really important to make sure you are well hydrated, and perhaps those are the days that you could look at increasing the salt intake. If you are going to do a heavy exercise session, making sure you're hydrated before, during it, and immediately afterwards can be really important. If you're going to have a heavy meal with a lot of carbohydrate in it, just to be mindful of the fact that your symptoms might worsen for a little while afterwards. And paying attention to all of these things can actually go a long way in terms of managing the symptoms. The first non-pharmacological management will be the salt and water expansion through supplementation, the blood volume expansion through supplementation with salt and water, and I've explained this in another video. If you end up needing medication, that will, for the POTS and orthostatic intolerance, that will either target this expansion of the blood volume, blood pressure, or the heart rate. And again, I've explained this in another video. A really important component of the management of any autonomic disorder is exercise. And we like to start the exercise program in the lying down position. This is because being upright can be a stress on the autonomic nervous system, and it may simply be quite difficult for you to exercise in the upright position, or you might find you can only do so much and you never manage to do any more. So if you start in the lying down position, then you can eventually move towards the upright position, and you'll probably find then that you can do a lot more in the upright position. So we start with something like a rowing machine, if you have access to that, and I have another video on home exercise equipment, and also another video on showing the rowing machine that I recommend to patients. It's very neat, it's quite inexpensive, and you can get it from Decathlon. Your exercise program will also include resistance training, and again we like to focus on the lower body for the legs, but also the upper body should form part of the exercise program, and you can again start in the lying down position. So exercise is a hugely important component of your treatment plan when you have POTS or orthostatic intolerance. In the rest of this video, I'm going to talk about other symptoms that commonly occur in patients who have POTS and orthostatic intolerance. So that can be fatigue, sleep disturbances, and pain. So when it comes to fatigue, obviously this can be a very difficult symptom to treat, and it can have a hugely negative impact upon someone's day-to-day functioning. The most important component of the management is try to figure out some level of stability in your day-to-day routine. If you manage to reach a state of stability in your routine, then it is much easier to begin to learn which activities deplete your energy and which activities don't take that much energy. And that way you can plan out your day-to-day activities based on the amount of energy you have and knowing how much energy certain activities are going to take. So that would be the most important piece of advice when it comes to management of fatigue. It might be a good idea to keep a diary for a short period of time, just to get a sense of what your routine is actually like and how consistent it is. But consistency will be really important in managing fatigue in an ongoing basis. The next component that's important to target is sleep, because a lot of patients do report poor, unrefreshing sleep in the context of having conditions like POTS and orthostatic intolerance, and now more and more we're seeing it in patients who also have long COVID. What's really important and what is advised by sleep experts is that you focus on the wake up time and you try to keep that as consistent as possible. And then you can count back 7 to 9 hours to get your going to bed time. So there can be a little bit of flexibility on the time you go to bed, but you should mostly try and wake up and get up around the same time every day. And this is felt to lock in your circadian rhythm. It's also important to pay attention to your wind down time and to try to avoid looking at screens right before you go to sleep, because the screens emit blue light and the blue light tricks your brain into thinking that it is the day. Another common symptom in patients who have conditions like POTS and orthostatic intolerance is pain. So this can be divided into migraine or headaches and just generalized body pain. When it comes to migraine, the management of it is similar to patients who don't have conditions like POTS and orthostatic intolerance, especially in the management of the acute headache. So any medication that's given to treat an acute headache would be pretty much the same with or without orthostatic intolerance. When it comes to the more chronic treatments of migraine, so the treatments that are taken on a daily basis, regardless of whether or not you have a headache, there needs to be a little bit more consideration. So one of the common medications used to treat migraine would be amitriptyline, and theoretically this can worsen some of the symptoms of orthostatic intolerance. It doesn't happen in everybody and it is at a low dose, but it is just worth considering and being mindful of if you are going to be on this medication. Propranolol is another medication that is used to treat chronic migraine, and it is also used in certain patients with POTS, so that may help both symptoms, but again, it's worth the discussion with your healthcare professional. There can be other types of headache that is slightly more common in patients who have POTS and orthostatic intolerance. There is a headache called a coat hanger headache, which is relating to the upright position. So some patients with a dysautonomia can get a pain across the top of their shoulders when they stand up. And if you do get this type of headache or pain in your neck and shoulder region, that should hopefully respond in the same way as your other symptoms of dysautonomia to the blood volume expansion and the other medications targeting that aspect of your condition. It is very uncommonly reported, but some patients can get a low pressure headache from a spontaneous spinal fluid leak, and again this will cause a headache that is significantly worse when you are standing up and is relieved by lying down. Again, this is a really uncommon type of headache, but it has been reported, and it is slightly more common in patients who have the Ehlers-Danlos syndrome, joint hypermobility type, which I have described in another video. It also can be reported that patients with POTS and orthostatic intolerance just have overall body pain or chronic pain. This can have a neuropathic nature, such as burning pain or shooting pain, or else it can also be just aggravated over time by a hypervigilance to pain signals that initially might have been protective, but over time can become maladaptive, and then you can exist in a state where you feel a lot of overall body pains. In this context, it is probably a good idea to either chat with your GP or with a pain specialist about how to manage that pain on an ongoing basis. But again, non-pharmacological approaches will probably be used first, so that being exercise or things like cognitive behavioural therapy, but it is definitely a very individual approach to the management of this type of pain. Patients who have a dysautonomia can also have pain from the dysautonomia itself, in terms of if they have a lot of chronic constipation from having the dysautonomia, that can certainly lead to pain. And then patients who have the joint hypermobility Ehlers-Danlos syndrome and also have POTS, they may report pain that is generated from joint hypermobility. So this was just a quick run through of some of the other symptoms that patients with POTS and orthostatic intolerance can experience, and just ways of how we would go about managing those symptoms.